my name is Carrie Brandt. I will be your home health nurse for today's head to toe examination. First, let me go ahead and wash my hands. Normally I would do this with soap and water, but we're going to do this for the exam purposes. All right. And let me go ahead and check your armband real quick. Do you mind stating your full name?
Vernon Brandt.
And your date of birth?
August 30th, 1970.
Okay, great. And now, Vernon, what I will be doing today is I will be checking your skin, your heart, your lungs, and your abs. And before we begin, do you have any questions for me?
No.
Okay, great. I'm going to ask you a few questions real quick. I'm going to ask you to restate your full name.
Vernon Brandt.
Do you know what time of the day it is?
8 o'clock.
Okay, great. And do you know the location we're at?
Elizabeth.
And what I'm here for today?
Physical.
And do you know the current president?
Trump.
Great. All right. The client is alert, attentive, oriented. His oriented ×3. His speech is fluent, clear, and typical comprehension. All right, Vernon. What I'm going to be doing first is checking your blood pressure before we start the full head to toe assessment. And before I get this started, have you smoked today or had anything to drink recently?
No.
All right. And your feet are straight and on the floor. Are you comfortable?
Yes.
Can you lift your arms straight above your heart rate? And there are 2 fingers between the blood pressure. It's one on your cuff. Okay. All right. Keep it straight. All right, perfect. Your blood pressure was 120/70. All right, Vernon. First, I'm going to check your eyes. Actually, I'm going to go ahead and check your scalp real quick for any bumps or lesions. There are no lesions. There's no signs of alopecia, no baldness. Hygiene is good. All right. I'm going to check the size of your pupils. They are around 3 millimeters pupil size. And excuse me. What I'll be doing right now is I'm going to have you face the wall. And I'm going to take this object about 12 inches from your face and pull it in 3 inches. All right, great. You gonna look up? All right. All right. All right. His pupils were equal, round, reactive to light and accommodations, and he had a positive red reflex. And his eyes are symmetrical to his ears. His sclera is white, his conjunctiva is pink. And if I could have you open your mouth, I'm going to check your oral membranes and say ah.
Ah.
Okay, in your cheeks, there's no signs of lesions. If you could pull it down under your tongue, perfect. And you can pull down your lip. Right, everything is moist, pink, no signs of lesions, nothing irregular. All right, now Vernon, I'm going to check your ears. First, I'm going to put on a clean earpiece. Check the light. Now, if you have any tenderness, let me know when I pull your peanut back. All right. On his right ear, it is clear. No signs of wax. It is reflective of the light. It's pink. It does tickle, doesn't it?
A little bit.
Okay. No sign. It's clean. No signs of infection. Reflective to light and clear. Okay, well, let's get rid of that. And when I took his blood pressure, he was in a sitting position, and it was on his right arm. I see you're used to these physicals. Let me check your skin real quick. Okay. Now, he is covered in tattoos, but he has no signs of lesions. No moles with abnormal borders. No signs of jaundice, cyanosis, pallor, or ecchymosis. And same with his right arm. No signs of jaundice, no lesions, nothing abnormal, no abnormal borders on his moles, no jaundice, ecchymosis, or cyanosis. Now I'm going to check your temperature bilaterally and the interiorly. Dry and warm, warm and dry, 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 warm and dry. Perfect. Now I'm going to check your radial pulse bilaterally and for a full minute. I'm going to do it for 30 seconds today, just for testing purposes. And for time. All right. His radial pulse beat is around 88, and it is bounding and strong. I would rate it a 4. I'm going to check your capillary refill bilaterally. Okay. Your refill is less than 2 seconds. Perfect. Now what I'm going to do is I'm going to go ahead and test your musculoskeletal reflex. If you could just push against my arms. Perfect. Now squeeze my hands. Great. The strength is strong. I would say I would rate his resistance and strength at a 5. And he has full range of motions. Now I'm going to check the turgor of your skin. It was, the rebound was brisk. Perfect. No signs of dehydration. Now I'm going to go ahead and check your legs and your feet. I'm going to get a set of gloves for this. Okay. I'm just going to sit on the floor since your strength was pretty strong. I don't want to fall down. All right, Vernon. Are you able to see your feet up there? Okay, good. Perfect. Now, I'm looking at your skin, and I see no signs of jaundice, ecchymosis, cyanosis, or pallor. No lesions. A few mosquito bites. Nothing abnormal. No abnormal moles. His temperature bilaterally, interiorly, is warm and dry. 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 And I'm going to check your tibial edema reflex for 5 seconds. 1, 2, 3, 4, 5. 0 pitting, no edema. All right. Now I'm going to go ahead and check your pedial pulse bilaterally. We'll pretend I did it for a full minute. It is it's very strong, bounding, and I would rate it a 4. And let me go ahead and put out some gloves. All right, Vernon, I'm going to check your capillary refill on your toes bilaterally. Your big toe. Your other toes. Okay, it was less than 2 seconds, which is perfect. Now, what I'm going to do is I'm going to check your plantar reflex and your range of motion. So I'm going to have you push against my feet. Okay, that was really strong. And lift your feet up and down. Okay, his range of motion, he has full range of motion, full strength and resistance. I would rate it a 5. Okay, you can go ahead and pull down your pants legs. Let me get rid of this. Throw it away. I'm going to go ahead and wash my hands, even if I wear gloves, just for your comfort. Okay, Vernon, what I'm going to do next is I'm going to listen to your heart to see if there's any presence of, bless you. Bless you. Okay. If there's any extra heart sounds or murmurs. And I'm going to be listening in 5 locations. And on the 5th location, I'm going to listen for a full minute, turn it over the stethoscope, and listen to it with the bell of the stethoscope. It may take a couple of minutes to do. Doesn't mean there's anything wrong. Excuse me. Must be something in the air. Let me wash my hands again. Okay. Okay. First, I'm starting with your aortic valve in the second intercostal space. Your pulmonic valve in the second intercostal space. I'm going to lift your shirt up. Okay, thank you. Your herbs, third intercostal space. It's very strong. Tricuspid. Okay, and your fourth and fifth intercostal space is your mitral. And I'm going to listen to this for a full minute. It's at the apex of your heart. Okay, his heartbeat was strong. No signs of murmur so far. That was for a full minute. No extra heart sounds. I'm going to go ahead and turn it over to the beloscope and listen at your mitral. Okay, at your tricuspid. Normally I would have a blanket or a gown over the patient, but he said this is fine. Are you comfortable? And now your herbs, your pulmonic space, second intercostal space, and your aortic, second intercostal space. And now I'm overviewing his chest, and there are no presence of heaves or lifts. He had no presence of splitting, extra heart sounds, or murmurs. Nothing irregular. Okay, now Vernon, excuse me. I'm going to listen to your lung sounds, and what I will be doing is I will listen to 8 to 10 spaces in the zigzag motion, and then I'll have you stand up and I'll listen to the back and have you breathe in deep, and I'm going to make sure it's symmetrical. Okay. All right. First, let me go ahead and do the inspection first. Now, what I'm doing here is I'm making sure that you are not barrel chested, which takes away any signs of COPD. Well, it doesn't take away all the signs, but it is a good indicator. And you are not barrel chested. You have you are transverse symmetrical, less than transverse. Now I'm going to listen to your lung sounds. Okay. Now every time I place my stethoscope on your skin, I need you to take a deep breath in and out. I'm going to start above your clavicle. Deep breath in. I'm sorry, one more time. Perfect. Again. Now, if you get dizzy, let me know, and we'll stop. Deep breath in. Perfect. Now I'm going to lift your shirt up. Is that okay?
Mm-hmm.
Deep breath in. Deep breath in. Deep breath in. And that was 1, 2, 3, 4, 5, 6, 7, 8. Deep breath in. Deep breath in. One more time. One more time without the yawning. Okay, and I'm going to listen under your arm. Deep breath in. Perfect. And if you don't mind standing, I know we were check the front while you're in sitting position, but I'm also going to check it for camera purposes. If you don't mind lifting your shirt, is that okay? Is that all right?
Mm-hmm.
Okay. Now I'm going to check the posterior view in the same zigzag motion. Ready? Deep breath. Deep breath in. Deep breath in. 3, 4, 5, 6, 7, and 8. Okay, on inspection, there are no lesions, no signs of jaundice, no irregular borders on his moles. If you could lift this up, I'm going to have you take a deep breath in. Okay. One more time. One more time. Okay, great. That was to make sure everything was symmetrical and transverse. All right. There we go. All right. While you're standing up, I'm going to go ahead and check the rest of your musculoskeletal examination. Right now, there are no signs. His posture is straight. If I could get you to turn sideways. His posture is straight. I see no S-curve, no deformities right now, no lordosis or kyphosis. And if I could have you bend over, I'm going to palpate your spine. Okay. Okay, there's no abnormalities. There's no S-curve. No signs of scoliosis. Okay, Vernon, for the last steps of our examination, I'm going to osculate your abdomen, and I'm going to have you lay down in 30-degree angle. I see this is your book. Is it good?
Yes.
Okay, good. And what I'm going to do first is inspect it. I see it is flat, homogeneous color. No signs of lesions, no signs of jaundice, no signs of periolitis or pulsations. His midline umbilicus, there's no signs of drainage or discoloration. Okay, I'm going to cover you up for your privacy while I'm doing this. I will have to lift your shirt to osculate it and palpate it. Is that okay?
Yes.
All right. All right. I'm going to start with your upper left quadrant, and I can listen up to 5 minutes. And what I'm going to do is I'm going to listen until I hear your first bowel sound. Okay. Perfect. Your lower left quadrant. Perfect. It's perfect. I'm listening for a full minute on each quadrant. And there was no sign of hyperactivity or hypoactivity. There was normal activity. Everything was fine. As I said, his abs are flat. And no lesions. What I'm going to do now is I am going to do a light palpation and a deep palpation on all 4 quadrants. I just need you to tell me if there's any tenderness. Okay. Lower left quadrant, Lower right quadrant. Lower right quadrant. Was there any pulsations or tenderness?
No.
Okay, great. Now I'm going to go ahead and push in deep. Lower left quadrant, lower right quadrant, upper right quadrant. Okay, was there any signs of tenderness?
Nope.
Okay, I would say that everything was fine. If you want to go ahead and stand up and put on your put your shoes back on, we'll complete this visit for now. I'm going to go ahead and document this. And were there any questions before I leave today?
No.
Okay, great. Well, thank you for your home health visit.